Good morning, everyone. It's a real pleasure and honor to see you all here today. Welcome. Welcome to our regional online event about human rights in the field of mental health and in the region of Eastern Europe and Eurasia. It is truly incredible how easy it is these days for people from across the world to get together like this. So it's very nice. My name is Ichilingradian. I will be moderating today's event. So first of all, there are a few technical matters which I would like to say. So please be informed that the event is audio and video recorded, and the recording will most probably be publicly shared and distributed in the near future. Whenever you are not speaking, we ask you to please have your microphones off to avoid any noise disturbances. On the other hand, we really ask you to have your cameras on if possible, because we would really appreciate seeing your beautiful faces, and it always helps to facilitate a better discussion as well. We have our colleague Yeva Laugalite. She's here with us today, and she will be responsible for all technical issues. So if you have any questions, please approach Yeva directly. You can do that via the chat. I guess the easiest way to do it would be via the chat, and she will be glad to help. So thank you, Yeva. Also, throughout the time of the presentations, you may write your questions, comments, and ideas in the chat as well. And if you would like to say anything or ask a question at any point during the event, please use the raise hand function first, and then Yeva will notice you and we'll moderate that. Okay, so I think that's the technical part. Moving on to the more interesting content part. As we all know, human rights in the field of mental health, intellectual and psychosocial disability has been quite a neglected area for decades, especially in the region of Eastern Europe and Eurasia, but across the world in general. For a long time, it has been predominated by pretty much the biomedical perspective and the field of psychiatry. However, with more and more developments in the field, mental health is no longer a matter for only the field of psychiatry. Of course, it's still a big and important part of it, but also it includes and concerns a complex combination of biological, psychological, social, environmental, and other factors. So the importance of intersectoral, multidisciplinary, and convergence approaches is becoming more and more apparent and appreciated and talked about. So the relationship between mental health and human rights is, of course, integral and interdependent, but in general, we like to think of mental health as not a privilege or a commodity, but it is first of all a human right. Hence, it is not only a matter of individuals in society, social impact, public health, but also it is a matter of fundamental human rights. So it is an honor to now introduce to you the director of the Human Rights Monitoring Institute in Lithuania, Professor Dainius Puras, who will give his presentation about the global context and human rights-based approach. And also he'll talk a little bit about the local context in Lithuania and the progress of the institutionalization in our country. So Dainius, the virtual floor is yours.
Thank you, Ugne. Hello to everyone. Всем большой привет из Вильнюса. I will be speaking in English. And first of all, I would like to thank all of you for excellent work you are doing in the region, in the field of mental health and human rights. And with this meeting, we would like to invite us all to strengthen networking, which already exists, but just to add to it, to strengthen networking among us, among those experts and organizations who are willing to see the change in mental health field. As you know, the timing is unique. and I will share my insights. I was happy to be in the middle of all this global process for 6 years, from 2014 until last August, when I was serving as a UN Special Rapporteur on the right to health. Now I am, so to say, back to the region, my beloved region of Central Eastern Europe and Eurasia, and I would be very happy with my organization, Human Rights Monitoring Institute, and the coalition we have in Lithuania to have more cooperation with all of you. So, as you know, mental health is quite a new priority since around 2000, maybe at least last 20 years. It is recognized as a global priority in health and social welfare. And there is a lot of agreement about that mental health and mental health services need much more investment. So this is easier part. And then there is some disagreement or tensions about how to move ahead, how to invest, how not to invest anymore. We know a good movement, a powerful movement on global mental health, and we have much in common with them. Maybe they, it's my opinion, they emphasize too much treatment gap and how to reduce burden of mental disorders. And this is a good idea, but this may lead to, may reinforce vicious cycle of status quo. As we know, last 40 years in all the world, there is a dominance of biomedical model, which replaced psychoanalytic model many years ago in the West. And this biomedical model is nothing wrong, but in many countries it is overused. And it creates power asymmetries, it creates disempowerment of users, and it creates biased use of knowledge when, you know, future doctors and future doctors are still taught about that mental health conditions are because of chemical imbalances in the brain. And this is theory which was hypothesis which was never proven. So in many countries now, in East, West, North, South, the dominance of status quo is discussed. And the consolation for our region, because sometimes we are thinking that our region is famous for especially huge burden of problems, like, you know, heavy burden of institutionalization and so on. So consolation from my experience, having seen the situation in all the world, that now all regions and all countries, including advanced countries, I mean, Western Europe, North America, Australia, they are also understanding that they need change. So in this new paradigm, all countries are like developing countries, and our region may be special to some extent, but all regions discuss how to make change. It's a very interesting debate is about where the change could be easier in global North or in global South. And many experts paradoxically think that in global South, the change could be easier because there is some kind of vacuum. There is no system of mental health services, so you have a space for innovations. And in global North, there are so many sophisticated psychiatric, institutions, maybe not necessarily large and inpatient, but outpatient, and it is very difficult to make changes. So our region I think is quite good with regard to innovations. Just we have to use this very special time. So during my rapporteurship, I was focusing on mental health and human rights, and I had 3 reports on this, but mainly what was most interesting was to travel, to go on country missions, including in our region. I was on 2 country missions, official country missions in Armenia and Kyrgyzstan, but also I was in all other regions, including Fiji and Ecuador and Croatia and Canada and many other countries, and I could see this failure of the systems everywhere. And also I could see many promising signs, meeting people who are passionate, want change, including mental health professionals, and also users of services, experts by lived experience. So they are very powerful in global south, global north. I think our region needs more such groups. And one example I want to share from my experience before rapporteurship, and it's about our region. When we met some 10 years ago, maybe in Bratislava, and we discussed cage beds, you know, the story of Central Europe. They have a legacy of cage beds. They close people into cage beds. And we're telling to colleagues from Czech Republic, Slovakia, why you support this? This is so horrible to have people locked in cage beds. And they explained that this is the history of Austro-Hungarian Empire, and they use this method because they think that it is lesser evil to compare what we are doing, what we have been doing in other empire. And to their thinking was that this is not so harmful as overuse of chemical restraints, which our countries were using, and not cage beds. So I just want to tell that this was a very sad discussion, you know, to talk in 21st century in the middle of Europe, how we manage, mental health issues with cage beds or with high dosages of psychotropic medications. And this is why we all know that we should somehow abandon this legacy of any kind of, disempowerment and overuse of coercion. So some words about Lithuania. We enjoy democracy, we have vibrant civil society, and we have broad spectrum of views on every issue, including mental health. We have different groups and which compete, and some support status quo, like in other parts of the world, and some insist on change and are not happy with status quo. So we have a coalition on Mental Health 2030, which is represented today here. This is a coalition of organizations and experts who are pushing government to essential change, to rights-based approach. And the Human Rights Monitoring Institute is now serving as coordinator of that coalition. And we have a grant from Open Society Foundations. And part of this project is about Lithuania. Another part is about facilitating networking in the region, in our region, let's say Eurasia, to promote human rights-based approaches and to mainstream in mental health, to mainstream these alternatives, rights-based alternatives in mental health services. As you know, there can be more broad or less broad view to mental health. When I was special rapporteur, I was very often reminding to governments that mental health is about also enabling a non-violent, or let's say democratic environments in all settings. So it's before we go to psychiatry, mental health service, it's about, enabling a non-violent environment in family, in school, in workplace, in community, in broader society. So without all this, good mental health of population is not possible. But then we move to mental health services, and of course, mental health services also should be free from helplessness, disempowerment, and discrimination, stigma, and so on. So if we agree on all this, we could think together as a self-help and mutually supportive group how we move ahead in our countries and in general in the region, and how we share good practices. For example, in Lithuania, we identified systemic obstacles in mental health system, and we now have recognition, approval from our government that the system is not working, and there should be serious changes. So we have many outpatient mental health centers, and some people are proud of them, but we identified that these centers mainly provide medications, and they feed then psychiatric hospitals with new patients, and they feed long-term care facilities. So we have 3,000 beds in psychiatric hospitals, and we have 6,000 beds in these long-term care facilities, which are full. There are even waiting lists. So for our coalition, it is an illustration of failure, that during 30 years, we did not create alternative community-based systems, and we just advise relatives to place their loved ones in long-term care facilities. And for less than 3 million people country, to have 3,000 plus 6,000 beds means at least waste of resources, but also it's against human rights. So it's not to say that we do not have achievements. We have good pilot programs in the prevention of suicide, prevention of bullying. We have some good services in child adolescent mental health and adult mental health. But if we speak about system, the system is failing. But the consolation is now that the whole world understands that in most countries, the mental health systems have gone to the way which is not effective. So now we have this sobering understanding by parliament and by government. And last 2 months, for example, in Lithuania, we had at least 2 events under patronage of parliament's speaker, our speaker of parliament, Victoria Nielsen, who was famous as one of best chess players in the world. And now she's famous as a speaker for Lithuanian parliament. And so we had a general conference on the need to transform mental health services with clear arguments, and discussing how to do this, how to overcome some resistance. But now, 3 days ago, we had a discussion with her, and it was televised. It was open to everyone. Where we had about child adolescent mental health, how to move ahead with services for autistic children, children with intellectual disabilities, but also adolescents who especially suffered during quarantine. We had quite long absence of schooling in our countries, and as we understand, for children and adolescents, is additional burden for their mental health. And so this is about the developments in Lithuania, and we hope that now change is possible. But back to the region, as you remember, we have shared with you some time ago strong statements coming from Council of Europe and Commissioner for Human Rights of Council of Europe. And now, as you know, and for me, it was a very pleasant surprise what happened on 10th of June, so just 3 weeks ago. This WHO guidance on community mental health services, promoting person-centered approach and rights-based approach, was launched. And we strongly recommend to all of us to use this document in our advocacy, because this was told now by WHO, not by some special rapporteur or some other organization. So as you know, sometimes people who are advocating for change are criticized as if they are having something in common with anti-psychiatrists. Like I sometimes hear that my reports are like anti-psychiatric reports. No, it's about psychiatry, how to modernize psychiatry and mental health care. So I think nobody will dare to say that WHO took anti-psychiatric approach. No, the WHO is willing to change mental health services globally, and I'm happy that finally this decision was made by WHO. I just want to read some short sentences which are from this document. Although some countries have taken critical steps towards closing psychiatric and social care institutions, simply moving mental health services out of these settings has not automatically led to dramatic improvements in care. The predominant focus of care in many contexts continues to be on diagnosis, medication, and symptom reduction. Critical social determinants that impact on people's mental health, such as violence, discrimination, poverty, exclusion, isolation, job insecurity, or unemployment, lack of access to housing, social safety nets, and health services, are often overlooked or excluded from mental health concepts and practice. This leads to an overdiagnosis of human distress, over-reliance on psychotropic drugs, to the detriment of psychosocial interventions, a phenomenon which has been well documented, particularly in high-income countries. It also creates a situation where a person's health is predominantly addressed within health systems, without sufficient interface with the necessary social services and structures to address above-mentioned determinants. And the last quote I want to read from this new document: as such, this approach, therefore, is limited in its consideration of a person in the context of the entire life and experiences. In addition, the stigmatizing attitudes and mindsets that exist among general population, policymakers, and others concerning people with psychosocial disabilities and mental health conditions, for example, that they are at risk of harming themselves or others, or that they need medical treatment to keep them safe, also leads to an overemphasis on biomedical treatment options and the general acceptance of coercive practices such as involuntary admission and treatment or seclusion and restraint. So very clearly, WHO joins other experts and organizations who are warning that the current status quo is reinforcing helplessness, institutionalization, disempowerment, stigma, discrimination, and well, it's very difficult to change systems, but we need to do this, and now we have backing and support from World Health Organization. So this is very serious, and my idea that we should use this momentum. I'm especially happy that among 22 programs in this document, there is a special chapter on good practices. We have Georgia, and congratulations. So Georgian colleagues will speak about it today, if I understand correctly. So we are very proud of you and your success. We know that there are quite many other promising efforts in the region, but the idea of our networking, which we suggest, is to share these good practices, maybe to share challenges and obstacles, which we have a lot in common. But I would recommend to focus more and more on strengths our region and our countries have, on opportunities, on good pilot projects, and how we could do this cross-fertilization so that we become strong in all our countries. I have now, after these 6 years, I have a lot of allies in the world. And even if I am already 1 year not anymore special rapporteur, I think every second day I have some meeting with, Uruguay or Thailand or some other country in the region, because there are many professionals, many users, ex-users of services, which want to involve me in their activities. Frankly, I would like more to work with our region, and this is why I hope this is just kick off the first meeting. We do not compete, and we do not want to replace other networks which already exist. Just we want to strengthen this networking between experts and organizations who are ready and who are willing to have this essential change in all of our countries, because I think in each of our countries there is a space for change, and maybe it is already happening, as I told about my country, and I hope you can share experiences from your country. So this is mainly the idea. And this is the context which I described in my own ways. I was very happy to facilitate, to contribute. Of course, it was modest contribution. One mandate, one person who has only one very small support group cannot make change. But when I read this WHO guidance, I am also a little bit proud that with all other experts, with people like you, with the special rapporteurs like former special rapporteur on rights of persons with disability, Catalina Devandas, who is now ambassador of Costa Rica in Geneva, we did, well, this change, which resulted in WHO guidance. And this is a very good advocacy tool for us to progress in our region. So now I stop. Thank you. And I hope we will have a fruitful exchange of ideas today, and then we will proceed to see what will be next steps. Thank you very much.
Thank you very much, Dainos. It was very inspirational as always. Thank you for your presentation. So next, I am very happy to present to you Maya Shishnashvili from Sakartvelo, from Georgia, who will share with us her presentation about the community-based service Hand in Hand. It is always very important, as Dainos said, to see and share good practice examples and examples of how things could be different, could be done differently, could be done better, what vision it could be for various community-based mental health and disability supports and services in our region. So we are very happy to have Maya here with us today. Maya will give us a brief presentation, and then straight after that, we will also watch a very short documentary video about Hand in Hand. So Maya, the virtual floor is yours.
Hello, everyone. I'm so glad to see many familiar faces here. I hope that they also have heard about a little bit about Hand in Hand. So my brief presentation give you some additional information regarding community-based housing service, which recognized by WHO as one of the best practices in the world, and it was suggested for development in each country, at least in transitional period. So I will try to fit in the time. I'll try to be short, but if you have question later, you can just ask me for detailed information. So community-based housing is the right to live independently and be included in the community. How I came to this? I came to this because I have child with severe developmental delay and some, for now, some additional behavior challenges as he grow up. Some challenges are coming and we have some challenges to control it, to change it. So if we are talking about the country context, I just want to remind you that Georgia is, Sakartvelo is a little country. We have population about just 4 million. And from the perspective of the services, residential services, country has large residential facilities where about 200 people are located. I'm talking about 200 people are located in large shelters, which are considered as social welfare services. And there are some psychiatric clinics, which also include some residential services, but they are considered as a part of mental health healthcare services. But in reality, they serve as residential services for people with psychiatric disorders or diseases. There are up to 500 people who lives there. So Eka, who is our participant, can add to this information further. We have also so-called community-based housing with the standards allowing them to serve up to 24 people at one place. So in reality, they are mini institutions. And family style housing, which is new service, relatively new service. New, I'm saying because it is still novel for Georgian situation, Georgian community, although we started it in 2000, by the end of 2011 by helping of so-called Soros Foundation, but in reality, open society institution, and to be exact, mental health initiative. And of course, local local open society foundation. And where are some other people with disabilities in families, because if you go out, you rarely see people with disabilities. Well, there are some changes with regard of children with disabilities, but with grown-ups, some little changes is happening, but not that much. As I mentioned, first community-based housing, I mean so-called family style housing in 2011 in Gurjani, and first residents of those houses were people with intellectual disabilities, mostly people with intellectual disabilities. But later on, we discovered that we need to expand the service to people with mental health diseases because of many reasons, and one of the reasons was that one mother, older mother than I was at the time before, approached me in one of the events and asked me whether we are going to serve people with different mental health diseases or not. And for that time, I was so I was not ready for this question, and not only question with this idea. And at that time, I said that, well, no, I'm not ready for this because I do not know how to serve properly people with psychiatric disorders. I guess I was, for that time, victim of the stigma, existing stigma in our society. But I'm proud that I started working on that. I have learned about this issue, and I, I've changed. I've changed because I know much better now about people with for example, schizophrenia and some other disorders. And into 2015, we opened in Tbilisi first house for for people with psychiatric disorders. And for now, we have 7 houses and 35 clients in 3 different regions, in Kakheti region, in Tbilisi, and nowadays in Ajara region, which is the west part of the country. And how we start, why it is distinguished for existing before housing. In reality, it is ordinary house in ordinary neighborhood, in ordinary cities or villages or towns, because and there are up to 3 to 5 people living in this typical household, like typical household. And the small number of residents of our services gives us possibility to see each person and to follow individual needs. So small number gives us opportunity and possibility to meet the residents' individual needs and give us opportunity to use person-centered approach. Person-centered approach, which is important and basic principle for human rights approach, and only using this approach we are able to help in self-determination of people who are living in our services, and it is especially important for people with disabilities who moved from large institutions, because they have I don't know, they have deprived for many rights, and therefore they do not know how to live in the community, what rights they have. Actually, they do not know what they like, what they do not like, and such elementary things. Therefore, it is important to help them and support them in self-determination in the first months, especially first 6 months is crucial. And sometimes it continues this self-determination period up to 1 year, and sometimes even more. It depends on severity of their conditions in the institutions. And we support in self-determination using different techniques of service, like active support, gentle teaching, which is extremely important with people with severe developmental delay. And I also put this technique, managing of behavior challenges, but in reality, we are using this technique quite rarely, because when we are using self-determination a lot and later active support and gentle teaching, challenging behaviors decrease by themselves, disappears by themselves. So sometimes we do not want to do anything special. And what is the one of the distinguish in our services, support staff comes from outside, because in some small group homes, especially with children, support staff lives together with residents, which is totally unacceptable in our service. People who lives in our small group homes, they have to live by themselves, because they have to understand and feel like that they home, and they have to distinguish what is difference themselves and support staff. They have to be queens and kings there, and support staff is just support staff and nothing to do with their homes and housing, just support. And we are using we are using very good tools for provide very good person-centered support. It helps us, and not only us service people, but also residents and persons what we are for whom we are doing person-centered services. These tools are maps and paths. Those are abbreviators. Map is very general and it is very useful at beginning stage. And path is more detailed, and we are, to be honest, we are rarely using path even now, when even now, because map still is working for our people, but still we have paths, and we are using only one or two cases because it's very detailed, goal-oriented service. And what is in reality, though, our services? So our assistants, they are working in a way, teaching and assisting of the residents. So they are helping them in self-care, not only just self-care, but in teaching self-care habits and skills. They are teaching and helping, assisting in communication and relation in the community, in the small communities. Not only small communities, but in the family, so-called family as well. And they are teaching and assisting in participation in housing and also community activities, because they are freely going out and participate in the activities, not only freely, but sometimes we do some active support in that, because sometimes they have, I mean, our residents have some problems going out, they have some fears, so we step by step helping them to go out and become active member of their society. And later we are helping them to acquire professions, seeking and finding their jobs. And if it is needed, we are working on assisting in worksite as well. So service is there where each person needs needs support on the way of independent living. And sometimes it's not enough, because we have a high rate of unemployment in the country. Therefore, we found out that if we find each resident's individual um, individual dreams, individual strengths, and if they have some idea, then we're just trying to um, make enterprise, I mean them to make some enterprise and support that. For example, on the pictures you see Georgi, who just he's passionate about the beekeeping, so he does that with his assistants, together with his assistant Tamrigo, and on the other picture you see Gocha, who loves doing traditional sweets, churchelas, and we are supporting them to do churchelas, and we especially support them in selling this product, because they in this they have some weaknesses, but they have the strength to do this great and delicious churchelas. We also support in different ways. For example, maintain relations and unified family. Gocha, and you see him in previous picture, Gocha and Natia, they are couple. They were couple for many, many years, but they were not able to live together in institution. And now they are living in one of the houses as a couple. We help them to bring in the same region their children, and one child was in another region, another child was somewhere else, and we could unify them. Right now they live in foster families nearby their house, but they are dreaming, and we are working now to bring those children together with their parents and we could successfully advocate, and now we are able and we are supported by state to have children in the service. Um, of course, if their best interest is considered. And what is life without leisure time and socialize and relax? And we supporting that too. And to be honest, all this work, first time we do a lot, and we appear as the service in our residents' life a lot in the first time, but later, as time goes and we grow their independence, living ability, we're just stepping back. So we're giving them as much opportunity to decide and to control their own life, and plus participate by financial participation. As much time goes, as much happens on this way. And if you ask our clients, service beneficiaries, what you like better, why it is different, and why you do not like going back or staying here, they are saying that it's freedom because they feel independence here. I think it's the best best reward for us. When they are thinking in this way. So if we are going through the steps, how it develops in the country. So we started in 2011 as a social innovation service with the help of Open Society Institute, and only two houses was opened, and after that many advocacy work was done, and many steps was milestones was uh, gone through. That was in 2014, children are allowed in our services. In 2015, people with the door was opened for people with mental illnesses. In 2017, it was acknowledged by the government and funded through the state program. In the state program, it appeared as a subcomponent, I mean, family style housing. In 2019, decision was made to increase funding dramatically. So it became close to real expenses and real needs of the service. And we did also training module, which was accredited. You understand? And by the Ministry of Health. So if there are followers of our service, now we have training modules by in Georgia as well, and we don't need to go somewhere else, and we can teach followers how to do this kind of service. And in 2019, new standards for these stricken standards received, which was very important because we were afraid that someone else will start the service, but they wouldn't follow the standards. So government now sets the new stricken standards for and which is based on human rights. And the great thing was, I mean, not only hand-in-hand perspective, but whole country's perspective. We did first evaluation of people with one of the psychiatric clinic. It is a Bediani clinic, and the door was open. It was first time. And we did together with our colleagues, and if Georgi Gelishvili is here, he can just provide some additional information of this process. When we evaluated need, each person who were locked in Bediani Psychiatric Clinic as for the institutionalization process. It was very good and sad experience, but we can continue if you are interested. And the good thing is that coverage of the state program for this service, independent supporting family style housing service, increased in the service. But stigma is still here, and there is no policy document, strategy document for the institutionalization, and if we have now working on that very hard. And I think pretty soon with the strong advocacy, we soon will have this the institutionalization strategy plan, and the best practice, which was included in WHO as a advice. We will also use this guideline for as an advocacy tool, and pretty soon we will start larger the institutionalization in the country. I don't know, I hope so. So thank you so much. I didn't know that you would say about guidelines, therefore I put some pictures from this guideline, and I think I exceed the time. Sorry for that. I'm very sorry. That's it. I will try to stop sharing this presentation. And give the word to next presenter.
Thank you, Maya. We will just watch a very short video now and then move on to the next presenter. Thank you. Oh God, we're really sorry. There was some technical issue, so there was no sound. I'm really sorry. We did test it before and it worked, but these things happen, unfortunately.
Thank you so much. Thank you that you shot this video, because when I saw that, I was so happy, because it expressed each person's character and
yeah. So we will try and maybe we can put it on YouTube finally, and then we can share the link with everyone, and then you can see it with sound and properly. We're really sorry. That's the thing that unfortunately sometimes you can't avoid, these technical issues. So thank you once again for this. We are a little bit behind schedule, but next, very quickly, I'm very glad to present Lilia Panteleva, the Executive Director of NGO Family and Society, who will present the current context and a brief overview of the developments in the mental health community-based services in Kyrgyzstan. And she will be followed, I believe, by Aybek Mukambetov, who will add some information about mental health and human rights activities that they run in Kyrgyzstan. So the floor is yours. I do encourage you to try and stick with the time allocated, because otherwise we might run out of time and not have enough time for discussion, which of course we all really want to hear from all of you and from all countries. So thank you very much. And now we have the presentation from Kyrgyzstan.
Thank you so much. Hello, everyone. I'm glad to see you, my friends and my colleagues. I hope you well and not Corona. It's a very terrible year, yes. And I'm glad to see you. And I'm from Kyrgyzstan. My name is Lilia. And during 10 years, we implemented and developed new service, community service at primary level. And we have changed mental issues in community level and primary care. We organization multidisciplinary team. Multidisciplinary team consists of psychiatrists and nurses and patronage worker. And multidisciplinary team focus people who have mental disabilities, schizophrenia and dementia. And family doctors focus for mental disabilities and identifying mental disorders such as depression and anxiety disorders. And we have a government program for the protection of mental health, 10 years, and issue new financial approach in Minister of Health between minister issues. Financial approach consists of new stimulation salary for doctors who identify mental disorders and treatment mental disorders. And in Kyrgyzstan now we have 12 multidisciplinary team, different region in city of Bishkek, Osh, Karasu, and Batken, and different region too. And we have effective study, great study of effectiveness, this multidisciplinary team, financial effectiveness and quality life effectiveness. And maybe Aybek presentation, our Kyrgyzstan development mental health. Aybek.
Thank you very much, Lilia. I would love to see you all in normal situation, face to face, finally, maybe this year or next year. But unfortunately, yeah, we have this still coronavirus waves, and I personally, unfortunately, have a repeated COVID-19 case. I think I have Delta stam. strain. Yeah, my treatment is going well. I mean, it's very. So in collaboration with national stakeholders and NGO partner organizations in the field of mental health and rights, and in the field of governance, good governance in terms of the monitoring and promotion of the national mental health program. So our close NGO colleagues from Mental Health and Society NGO, they were leading agency which engaged our local WHO office, then World Bank people, and our very close partners from region, including our one of our guests on this event, our consultant from Armenia. And together with some other stakeholders, we developed the mental health national program for the period from 2017 till 2030. So that was the crucial point in terms of the development of our, let's say, field. And now our community-based organizations are working on monitoring and promotion of the fulfillment of all activities included to the plan of action and the fulfillment of the government commitments to allocate the appropriate amount of money for community-based services, for services devoted for health rights, violations of the health rights, for the monitoring of these violations in the closed institutions, etc. So the second chapter of work, which we have been supporting for recent 7-8 years with our colleagues from Open Society Foundation, I mean Raluca, Bunea, and all her team, was about the, as Lilia said already, development and the sustainability of the community-based services in 11 cities throughout the 7 regions of Kyrgyzstan. And last but not least thing was about the working with the national stakeholders as Ombudsman Office, then the coalition of NGOs working in prevention of torture, and some other human rights defenders NGOs. So together with them, we are implementing the, I could say, the small initiative which runs the in parallel activities which include engagement of the lawyers and the human rights defenders in routine monitoring of the situation in closed institutions. So we annually develop the annual chapter within the Ombudsman Office report on the violation in Kyrgyz Republic, which we also are working on the field of budget advocacy to meet our government and the Ministry of Health in order to start the significant increase of the funding for mental health services, not only community-based, and in order to increase, say, more evidence-based and more modern medicines and drugs for treatment of the people in the closed institutions. Because now we mostly use the old style, I could say, post-Soviet, you know, clinical protocols and guidelines because of the financial restrictions, unfortunately. And in this regard, we are trying to, this is my last point actually, we are trying with Lilia's team and with other stakeholders to and to redevelop the plan of action, which aimed to the mental health system. So in result of maybe after 2-3 years, get the more structured and more effective system when some closed institutions reformatted, and with the reducing of the beds and with changing of the methods of the allocation and the transferring of this, money, saved money, for the implementation of the community-based services on ground, as multidisciplinary teams or clubhouses or secured living spaces, etc. So that's very briefly about our scope in Kyrgyzstan, and we'll be happy next to provide you more detailed information. Thank you.
Thank you so much for your presentations. Without further ado, I will just invite everyone now to join the discussion. You don't have to raise your hand anymore. You can just unmute yourself and just contribute to the discussion in as a natural way as possible. So the discussion is about how can we move forward towards human rights-based mental health and social care systems and services in our region. We invite you to share your challenges and opportunities you might see, any good practice examples, and just any ideas that are important to you in your country. And also, of course, we would like to somehow strengthen this network and maybe even think about some international advocacy activities. So please just go ahead and share your thoughts with us.
Hi, colleagues. Can I
Hello.
take a floor?
Yes, sure. Please do.
I'm Marietta. I'm representing here Armenian Psychiatric Association. And actually, I would like to share two different directions. I'm also working at the parliament as an expert on health issues. And I would like to share two main directions of our achievements in our country. The first one is related actually to the legislation, which was really interesting and big step forward to the community-based services in Armenia. Back in 2020, which was really very difficult year for public health in general, we achieved the amendment of our basic law on psychiatric care. And according to this new amendment, it is already written in a legislation that we need to move forward to the deinstitutionalization and to provide more community-based services. So now it's not only a protocol or some, for example, mental health plan or governmental program for implementation, but it's already kind of stuckled in the legislative document, in the law. And the other achievement of the legislation was that now it is allowed for primary healthcare providers also to provide mental health care services in case they are taking special training. Although these changes are yet on the paper, but still, I think that sometimes it's very important to write down the things and then you will think how you will implement them in real life. So now what we are lacking the instruments to implement these two big achievements in mental health. The sub-legislative acts, the real environment in order to provide this kind of services, the financial resources to put in this kind of changes, but still I think the paradigm of thinking about the services themselves is changing, which is very important for our country, I think. And the other small experience that I would like to share with you is that Armenian Psychiatric Association and AMBRA Mental Health and Well-Being NGO, the president, Lidit Bagdasaryan, is present actually in this meeting. She's with us. We are doing in collaboration with the Cagliari University and the Ghana and the Lebanon.
Unfortunately, I think we lost Marietta.
So I'll continue until
Okay, thank you.
will join. Little bit I'll present about the institutionalization. In 2016, the first home care services in Spitak city was established by support of Open Society Foundation and also Ministry of Labor and Social Affairs and Lori Regional Government. And if you will let me to share the back screen, I'll try to present. But no, just only that it was the first service in Armenia, and the plan was to implement all this institutionalization for whole country, but we wasn't able to do this, and there were big changes in our country. Also, the government, which was doing nothing on mental health care, was removed, not only for this, but for other things also. And then we started to develop private services, and in Yerevan there are several private services where we are using this multidisciplinary team approach and also other new things, and this private psychiatry, private mental health services are growing up in Armenia. Also, current government is interested in mental health because of war also, and first time in our history, our government decided to fund psychological care, and now for the victims of war, psychological services are free of charge in Armenia. And it is a historical decision because we are not aware that in other countries it was done. And now more than 10 or 20,000 people can receive these services free of charge. And now we are working on this. Also, I'd like to present that we have prisoners of war, not in Armenia, in Azerbaijan, and there are several hundreds, and it is a terrible situation for mental health of that person, for families who are living in Armenia, and their sons are prisoners of war, and our government is trying to do what is possible, but I think we need involvement of all human rights organizations to be involved on this matter. So this is what I was about to present. Thank you. And maybe if Marietta is back, she will continue about legislation.
Thank you. Marietta, are you back?
Yes, I'm
Yes.
back. Unfortunately, we have our lights off in Parliament. I'm sorry. It sometimes happens, like back in 90s. I joined when Dr. Soran was talking about the legislation. Dr. Soran, can you say what in particular
I was presented about this Spitak home care and also about post-war situation.
I will maybe continue from the point when I have stopped. I've stopped actually on presenting our multi-country project on quality rights and mental health, which is based on quality rights model of the WHO and is supported by the WHO and Human Rights Office, UN Human Rights Office. This project is already 3 years old, but due to COVID, we canceled our activities in 2020, back in 2020. But before that, we managed to do some trainings among mental health providers and among mental health service users in the main facilities that have long care beds. 2 of them had about 300 to 400 long care beds, and the other one is kind of combined service, which is hospital service, but with beds for long care. And they provide service to about 120, 25. The number is changing sometimes, 125 service users who are staying for a long time in these facilities. They are actually living in these kind of facilities. We have provided the quality rights model training in these facilities, both to mental health professionals and to healthcare service users. And the next step of this project is supposed to be the introduction of improvement plans for these facilities, because before entering and providing the training, we did the assessment, the baseline assessment of implementation of quality rights principles and the CRPD principles in this kind of facilities. Basically, that's what I was going to share with you. And if you have any questions, I will answer more detailed.
Thank you so much. That's it's nice to hear that there are some positive developments in Armenia. Anyone else would like to share anything? I realized that we've heard a presentation from Sakartvelo already, but yes, I can see Nino is raising her hand. So please, you're welcome to contribute.
Yeah, thank you. My name is Nino Mahashwili. I represent Global Initiative on Psychiatry Tbilisi office, and I work with most of you for years and years. News, Ugne, colleagues, I think it's a great initiative to create the coalition. As far as I see nowadays, there are only 4 countries, and perhaps step by step, other countries of the region could be joined. For instance, Ukraine, well, for instance, Uzbekistan, where the very interesting developments are going on, well, and so on and so forth. I think that News mentioned that this region really well shares the common history, common practices, unfortunately, biomedical practices in mental health, despite of all these beautiful well, developments that our countries also enjoy because of your efforts and devotion, dear colleagues. So how to create the impact of the coalition is the question, and I think we should, you know, when we will be growing and developing, a lot of other answers will come. But at this stage, I love this model that we are sharing with our best experiences, service-related experiences, but also law and policy-related experiences, because it is it could be enriching indeed if we really listen and try and take the vital components of the and scale up of these initiatives. I think that main point of this coalition is to use, I'm so sorry to be blunt, but to use the Danish status in the world and actually advocate for the rights-based mental health, because that is our kind of ace, joker. I don't know how it is in English. so how to put everything into this best advocacy stream? I think we should think and brainstorm about that. My initial thoughts are that we should perhaps produce the statements, or perhaps we should do some joint study on the burning issues like coercion or workforce with their biomedical attitudes, yeah, and what is lacking and what should be there for them to change their attitude and relationship with the persons with lived experience. And the main aim of the study should be the report that should be disseminated at the regional level, I don't know, high level conferences or meetings. So so it seems, well, it is very hard to come up with the answers during the first official meeting, but I see the potential. I'm thankful for this potential, and yeah, let's continue working, because we need all the resources that are around us, and we need unified fronts, because despite the fact that our governments now say that they prioritize mental health, we know that this is not true. Thank you, Ova.
Thank you so much. Yes, I have actually noted down your suggestion to maybe think about producing some sort of a joint international statement or call for action. So we can definitely work on that one. And also the research. You may remember we did come to Sakartvelo probably now 2 years ago, and we did start some fieldwork and research activities. However, due to COVID, we in the end had to cancel our next fieldwork, which was due in Kyrgyzstan. Unfortunately, yeah, it was not possible due to the pandemic situation. But still, we have collected quite a lot of information. I am still working on putting it all into some kind of a report. So once that's done, I'll definitely share it with you, and you can also add your insights or feedback, give us feedback, and we can see how we can use all that information as well for our international efforts. Also, I know that we do have Ukraine represented here, which was mentioned by Nino. I don't know, Yulia, if you would like to say a few words about the situation in Ukraine. Please, thank you.
So, thank you so much, Ugne. I'm happy to be here. My name is Julia Pievskaya, and I work for Ukrainian Psychiatric Association and also International Charitable Foundation Research Center for Social Policy. And we have a joint project with our Lithuanian colleagues. The Ukrainian Organization for Changes. We are trying step by step to change the situation with our social care homes, I mean residential facilities, because still in Ukraine we have about 30,000 people who are living there, and I mean adult people, and about 5,000 children. So when I was listening to your presentations and watching your beautiful video, I had two sort of opposite feelings. I mean, I was really impressed of the progress which your countries made in this direction, and while I was really upset because of situation in Ukraine. But we will keep trying. We will not give up. So I will appreciate you for all your sharings. I mean, your experience and your achievements. I think it will be very helpful for our NGOs who are working in this sphere for years. Thank you so much. It was my short.
Thank you. Thank you so much. Would anyone else like to share their thoughts and experiences, reactions?
If I may.
Please, yes, thank you.
And back to Hot Caucasus again. So, my name is Ichilingradian. I am from Armenia. I work for Armenia, and I'm a lawyer by my profession, and I have expertise in mental health law and teach mental health law in a university, and graduated from IGEL. Maybe you know IGEL diploma project and etc. I just wanted to introduce one of the projects we're starting with my colleague, who is also here, Musher. I guess he's here. So with Musher and with a couple of organizations, other organizations now, it's still in the development process. So Marietta and our other colleagues do not know about it yet, but we're going to disseminate information about it in coming weeks. So we're so we are 4 organizations. 2 of them are research organizations. One is more advocacy, is more an advocacy organization, and the other one is a service provider. Many of you may know, like Jeremy Gankun, a service provider for people with intellectual disabilities. They have already 3 houses in Armenia, basically, but with more than 10 people, residents in each. What we want to do is try to consolidate knowledge around independent living and right to live in a community, and create a consortium or create a network of interested parties around Armenia, who, including people, service users, and people who are residents of who live in some kind of institutions or non-institutions, house, etc. And try to put in basis for research-based and evidence-based policy making in Armenia, and push for policy changes in Armenia in order to. So it's this is a basic work. It's not like we're not going to create a service, etc., but some kind of, but try to do research in this field and develop guidance for research, and including for academia, because for me it's very important that academia gets involved as much as possible to have like data on the ground. Yeah, I guess it was kind of messy presentation, but that's it. I'm happy to ask any. I'm happy to answer any questions, and also it's really honor to be involved in this initiative. And we're looking forward to any kind of work with you within this project or any other projects. And maybe we will be sending to you some of our products for review, so don't be surprised if it happens. And I can't keep it myself. I'm really excited by Georgia's experience. I didn't know about this, and I'm looking forward to see it myself. I guess if I ever travel to Georgia, I will just contact you and say whether it's possible to see it on the ground. So yeah, thank you.
Thank you so much for that contribution. Yes, I have also noted down the academia involvement. Actually, it is very important, like I said before, the intersectoral work, and as many different sectors as we can involve in this, the richer the outcome might be. So yes, that's a very important point. Thank you for that. Any other contributions?
I just want to respond. Well, you are welcome anytime. Pretty soon our clients will be vaccinated, so it will be safe to receive guests, and also they just love guests. So just anytime you can visit us, see on the place. And I'm sure you will be more impressed than by my presentation, because when you see people enjoying independent living with support, that's something else. You have to experience by yourself. Thank you.
Yes, I can see Irma would like to say something.
Yes,
So.
I want to thank you for organizing this meeting online. Maybe we could see each other if not COVID, but anyway, so it's a great way of communication. To have this possibility to share experiences from the very global level, from local level, and thank you so much for presenters. It's very important to share the successes and what of challenges we face. And I wanted to ask you, Agna, you told about this future work, and could you share how you see the ways of further collaboration? So is it so we can have some regular meetings like this one, or we are going to we will have possibility to work on some projects together, or how you envisage the situation? So you been in our countries and have most updated information of it, probably together with Nino. She also is very active on this. Thank you.
Thank you. Yes, we actually don't currently have a specific project, but our NGO, Human Rights Monitoring Institute, we are, especially with Dainos now being our director, we are developing more activities in this field. And yes, regular meetings is one idea how we can keep sharing, you know, hopes and good practices, and maybe do, like I said, some international advocacy work, I guess, would be quite important for each of us, and then we can, you know, use it in our countries, but also international efforts are always stronger and have potentially can have more impact. So yeah, this, like I said, I've noted down the possibility to think about some sort of a joint public statement, or we can develop something like that, definitely. And maybe Dainos, maybe you could also contribute, because of course Dainos always has very great ideas and visions for the future. So Daino, maybe you could also contribute from your side what future we can see together as a network and as people working in this field.
May I add some couple of words before Danius will answer? So I'm from Open Society Georgia Foundation, and so probably some of you may know that there are some ongoing changes in the foundation, and so we don't know how foundation could support mental health work in future. So we have some possibilities to work on this maybe this year and maybe next year, but I'm not sure about further work. And so at this stage, probably especially important to have this network to keep it alive and to try to make our voices louder and to join our voices. Thank you.
Okay, maybe I can share some thoughts. It was very interesting to listen to you, and I had very good memories when listening to you from Georgia and from Kyrgyzstan and from Armenia. And now when we are trying to network in this situation of global change, global mental health change, I agree with the preliminary ideas of from Nino and others. I think we should not formalize this this network. It should be informal and open, without some strict borders who's in or and to cooperate with other networks, maybe with some organizations which have good experience, like Validity or Independent Living, Also, we have to think about fundraising. Yes, because we are not sure. We all are, so to say, too dependent from open society foundations, and this is strength, but even some risk. We should diversify our fundraising and to look for some other international donors. And then on contents, of course, research is important, change in training is important, users' involvement is extremely important, and I see the main, and maybe not so much about outcome, but we should see the process as important issue. We should not be so, I don't know, omnipotent to change the world or to change the region. There are many other actors who should be involved, but we should facilitate the process with awareness. Now, like this WHO document, very powerful and very helpful, and raising critical mass in the region and in our countries, like, you know, to get more allies among politicians, policymakers, professionals, and just people, I mean, broader society, like people, elite of artists, or, you know, and some celebrities. I was involved the last 6 years in, was one of consultants when you know, Oprah Winfrey and Prince Harry developed this series on mental health, and I recommend this series where famous people come out as with their mental health issues, like Lady Gaga and others. So we can see that it's happening everywhere, this awareness on mental health, and then if people understand that there are many problems, especially with pandemics and all this quarantine lockout experience, we have some feeling, we should prove this with the research, but we have some feeling that maybe also in your countries that more people in our region start to understand that they may have emotional or mental health issues, because there was this disconnect which was contributing to stigma. Yes, when people were telling, no, I cannot have mental health problems by definition because I'm normal. Yes, and then you just please do something with all these mentally ill people. And now we see that when people were locked in, when they were told stay at home, and when children were happy to stay not only with mothers but with fathers, but very quickly some emotional problems were developing. And then people started to understand. So our private practitioners, our private mental health professionals, let's say our psychotherapists, say that they have huge numbers of people coming and huge waiting lists. Not so much state outpatient services. Probably there is no trust in state services, like confidentiality issues, you know. So, but probably awareness about importance of mental health, finally, thanks to pandemics, is coming to our region. Just hypothesis. So that even men who were, you know, telling I don't have mental health problems, telling yes, I see that I have at least emotional problems. So they often use, instead of mental, use emotional. But I think it's the same. So just one observation which can help us to have more people on our side when we raise issues, mental health issues. And there are many, yes, there are many. It's about mental health of everyone, but one of our priorities in our network and in the organizations are those who are most vulnerable. yes, people with psychosocial and intellectual disabilities, and to liberate them from legacy of institutionalization. And we see how it can be done with the program in Sakartvelo and in other countries. My one observation from rapporteurship, when I had to see if my previous observations are valid for global mandate, because I had a lot of experience from my region, and I maybe was too much focused and too much critical on my region. I have to confess that I was idealistic about global North, let's say Western Europe, North America. I was thinking that they have almost perfect mental health systems. And when I was going to these countries, like official country mission to Canada, so there I met especially many NGOs who were coming to tell me how many problems there are in mental health services in Canada. So I was quite happy to hear that like in our regions, we had all this black humor that we were thinking that they do not have problems. Ох бы им наши проблемы, да, что-то такое. And then you go to Canada and you meet like 100 NGOs who come and tell, please do something about mental health in Canada. And then you understand why in Canada they have, still quite good situation because of very strong civil society, which is pushing government and national and provincial all the time. And then all the time they know that there can be no perfect situation. All the time we have to monitor and to improve when you identify some gap, or especially some human rights issues. And the most interesting debate for me, which maybe you all know this, but maybe you would say in other words the same, and it goes for at least 200 years. This dilemma, this tension. What happened 200 years ago when famous French psychiatrist Philippe Pinel, who suggested, let's say, one of the first reforms in mental health. He came to government and told, I have idea, let's, do you hear the screams? Do you hear the screams coming from dungeons, from cellars, where these mad people are closed and chained? So let us unchain them at least, and they will be, let's say, their quality of life will become slightly better, and they will not scream so much. So even we were more happy. So I present this in simplified form, this discussion. And they did this, they went to dungeons, and these mad people, they even were not called patients, they were misbehaving, they were, kicking and spitting with government people, and government people told to Pinel, are you crazy to suggest this change? Because look how they are behaving. And to what Pinel replied, they behave so because we deprived them of liberty and air and liberty. And after 200 years, when I was traveling to many parts of the world, including your countries, but also other countries, always I was going to these large institutions with many people closed, and the director of this institution will tell, you see how mental disease destroying these people, that they are absolutely hopeless and helpless, and there is no way even to try to deinstitutionalize them. So this is one opinion, and another opinion that it's not disease destroyed them, but our agreement to discriminate them and to deprive them of dignity, of rights and needs. And then there is self-fulfilling prophecy. If you decide that these are people diagnosed with schizophrenia is good for nothing, so after 10 years you go and see that they are absolutely hopeless. but you can go other way and to prove that you can do like you did in Georgia with the hand-in-hand program. So I don't want to say that everything is in our hands, but a lot is in our hands, and the time is very good for change. Just we need more to support each other, not to burn out, because there is still much resistance in the systems. But I think change is possible, and it's also happening. Just we need to monitor and to see these steps and the process. I have to confess that I did one compromise in my reports when I'm not sure if it was a good or bad decision, but I did not fully join with the CRPD committee, let's say, and I did not tell in my reports that governments need to ban all non-consensual measures now. Yes, idealistically, I agree, but I see that in reality, this is not happening. So my idea was to suggest some alternative option. And this alternative option that governments need, if they don't ban involuntary measures, then they would need to increase funding for services which are alternative services which are non-coercive. And then they should move towards elimination of coercion. And this can be a long process. So some critics from human rights advocates were not happy. They thought that I'm betraying. Of course, many psychiatrists were not happy, but from other side, critics, human rights people were telling that I sort of betrayed the idea of banning non-consensual measures, but just I suggested the alternative option. So we should try in our countries, if we are not so powerful, to convince governments to ban non-consensual measures. So maybe governments can agree to increase funding for creative, innovative services which are now promoted by WHO. So we go now not with some report of special rapporteur, we go to ministry with WHO guidance and maybe ask them to translate into national language, because it's WHO, you know, it's very serious. So I am now more optimistic, but still understand, and you understand how many obstacles are and challenges. But if we see this as a process, we can expect some good developments if we have more allies on other side, and we can use each other experience, I think. Because we say in Lithuania, you cannot be prophet in your own home. Yes, that I was always happy to cross the border, because when you go to the country, they will listen to you, and at home, you know, you understand that you cannot be considered as a you know, but it's global rule, let's say. So maybe we can have a group of our experts and use them for, you know, our region when we need to convince our politicians, our government. So maybe these are the main ideas about process, about training, about Philippe Pinel, and by the way, the World Psychiatric Association, which was not happy with, let's say, some of my reports, joined this, was active member in this these preparations for WHO guidance. So they are in the same boat. They are, I think they are changing, and this is very important. Not to disconnect psychiatry, not to say that we are doing all this without elite of psychiatry. I hope that World Psychiatric Association, European Psychiatric Association, and national Psychiatric Association, also young. We have in Lithuania, for example, Association of Young Psychiatrists, who are much more friendly to human rights and are very, very active. So I see many promising symptoms, so to say, about possible change. So these are my informal comments.
Thank you, Dino, and thank you, everyone. We are at the end of our allocated time, but I think it has been a very, very valuable event. So thank you all again for your active participation. We will be in touch, and we will continue this, developing this network of ours, and we'll definitely have more events like this in the future as well. So thank you all. And,
thank you so much. Have a great day.
Thank you. Have a good
Thank
day.
you.
Bye. Thanks a lot.
See you all again.
Bye. Thank you.
Thank you. Bye.
Thank you.
Thank you.
Bye-bye.
Bye.